One of the most pervasive threats to a child's bright future is also one of the least known. In Oregon alone, more than 11,000 preschool children are likely afflicted, and unless treated successfully in early childhood, it can have a profound physical, psychological, and social impact.
My grandson Justin is a wonderful boy, but he rarely made eye contact with people and he was very quiet. I just thought he was shy. When he was diagnosed, initially it was a bit terrifying. Obviously I was worried, but to be quite honest, I was also confused. Why had I never heard of amblyopia?
Amblyopia is the most common visual disorder in children and young adults. A central nervous system disorder, it impacts the communication between the eyes and the brain. Left untreated, it can lead to permanent visual impairment and even blindness. On average, amblyopia affects one child in every classroom, affecting as many as 5% of preschool children. Amblyopia can only develop in the first few years of life and is typically caused by unequal eye power, misaligned eyes, or blockage of vision. According to the National Eye Institute, visual impairment in children is associated with developmental delays and the need for special educational, vocational, and social services, often into adulthood. 70% of juvenile delinquents have uncorrected vision problems. 80% of learning in the first 12 years comes through vision. 1 in 6 school-aged children are 2 or more grades behind in reading. Behavior problems may be undiagnosed vision problems.
It's very difficult to detect amblyopia when the eyes are straight. In young children, the only way to pick this up is by a vision screening exam. If your child does have a failed vision screening, don't wait until it's too late. Have them seen by an eye doctor. Make sure the eye doctor performs a full examination, including dilation.
Thanks to generous donations from the Oregon State Elks Association, the Elks Children's Eye Clinic Preschool Vision Screening Program provides free screening to low-income children between 36 and 59 months of age all across the state of Oregon. The goal of screening is to detect amblyopia as early in a child's life as possible. Early detection offers the best chance for successful treatment and an improved visual outcome.
Justin was diagnosed through the Elks Children's Eye Clinic Preschool Vision Screening Program. Thankfully, we caught it early enough to be successfully treated, and the doctors at Elks Children's Eye Clinic saved Justin's vision.
A common cause of amblyopia, but often missed, is unequal focusing power between the eyes, with one eye usually being more farsighted than the other. Children with this condition who are not treated before age 7 or 8 are likely to lose use of their weaker eye. Myopia, commonly known as nearsightedness, describes the eye's lack of the ability to focus on faraway objects. This condition occurs if the eye is too long or the cornea, the clear front cover of the eye where the light enters, has too much curvature. Myopia is most often treated with corrective lenses, refractive therapy, or surgery in severe cases. Otherwise known as farsightedness, hyperopia is a condition when objects at a distance are easier to focus on than nearby objects. The condition is often present when the eye is too short or the cornea is not curved enough. Just like myopia, hyperopia may be treated by corrective lenses, refractive therapy, or surgery in severe cases. Anisometropia is another common cause of amblyopia. This condition occurs when the two eyes have differing refractive power. In other words, anisometropia is when one eye has substantially less strength than the other when focusing on objects near or far. Astigmatism is another very common vision condition characterized by the irregular shape of the cornea or the lens of the eye. A cornea with an irregular curve prevents light from focusing properly upon the retina, a light-sensitive area located at the back of the eye. This condition can cause blurred vision at any distance. Commonly referred to as crossed eyes, strabismus is a vision disorder in which the eyes are not aligned in a similar direction. This misalignment causes the eye to focus on two different fields of vision. If left untreated in children, the brain may learn to suppress the weaker eye in response to this confusion, causing amblyopia. Vision can be completely blocked by a cataract or by a droopy lid. The developing eye sees blurry images or nothing at all, and visual development is thus entirely prevented. These conditions must be corrected as quickly as possible so that amblyopia treatment can begin. Treating amblyopia involves encouraging the child to increase use of the weaker eye. This can involve patching the stronger eye for several hours each day so that the child will use the weaker eye, or placing a drop in the better eye to blur the vision, again so that the weaker eye has to work. Treatment may be required for several weeks or even months. The goal of screening is to detect amblyopia as early in a child's life as possible. Early detection offers the best chance for successful treatment and an improved visual outcome.
It's remarkable how proud he is of his glasses. He puts them on first thing in the morning. We don't have to ask him to. He loves looking at books now. He looks closer at toys. He seems to notice more details on things. Justin's mother notices a lot less frustration with school, and again, he's more outgoing, not as quiet as he used to be.
If your child fails the vision screening, don't wait. Make an appointment with an eye doctor today.